Um, Bob Ryder might Director Ryder is absent. Chair Harrington?
Present.
You have a quorum.
Thank you. Is there anyone registered to provide in-person or virtual oral testimony or submitted written testimony to be included in the record?
We didn't have any registrations, nor did we receive any written testimony.
Thank you. We'll go to item 3, and that's a report from Chief Corporate Compliance and Privacy Officer Nicole Amiro. Chief Corporate Compliance and Privacy Officer. She'll review the report and action items.
Thank you. Good morning. Nicole Almiro, Chief Compliance and Privacy Officer, here to share my report for this quarter. We have the compliance program overview and training metrics to share, along with the 2 charters we're requesting to be reviewed and approved. And then we have metrics for both our compliance program and the County Care Medicaid Health Plan, as well as share some what we're going to be doing for National Compliance Week. Okay, this slide we've seen before. This is the 7 elements of an effective compliance program, and we've spent considerable time this year on the bottom left bucket, the education and training. We have done multiple trainings on our compliance basics program and our privacy refresher, which shares about our compliance program, what we do, who to contact, how to triage issues, and walk through some case examples. And then on the privacy side, we do a privacy law refresher and some case examples. And the next slide, if you would, shows how this compared, how the contacts for our office compared both before and after our training. So the numbers of contacts are pretty much equal. However, what we did see is a deep decline in how they were reported, not the decline, but a decline in how they were reported on the hotline. There was much less on the hotline and much more in person or directly to the compliance and privacy staff, which is exactly what we want to see. We also saw an increase in the content related to our program in the calls that we did get. So I think both of those bode well for effective training, and we'll continue to do this in future next year.
So you're going to continue the training. You're going to do something like this again? Is it this?
Yeah. Yeah.
Okay.
Yeah. Because
and this period is what?
This calendar year, from January 1st to September 30th.
Thank you.
Can I ask a quick question?
Yeah.
Not about training, but number of HIPAA-related issues that were reported still look very, like a lot of issues. What are those compliance issues?
So we can talk about those in the metrics slide. I'll go over it with you then. But that's it's a good sign that people are reporting that. That means they understand that it's a potential issue, and they know who to contact. So that's kind of what we want to see. But we'll get into the detail in a few slides. If you don't. Okay. And then here, this is our Audit and Compliance Committee charter. Request to review and approve, please. It was last approved last year. We approve it, renew it every year. And then our next one, this is our new Compliance Steering Committee charter. This is a new committee whose purpose is to advise myself in support of you and the board in the oversight of our compliance program. One primary duty of this committee is to analyze the risk environment and develop policies and processes to reduce the risk, ensure compliance with our policies and relevant laws and regulations. So it's a request to review and approve our new charter.
How large is the committee and types of individuals?
It's yeah, I don't know the exact number, but probably between, would you say, 15 to 18?
Yeah, a little more than half of the senior leadership group.
Yeah.
Roughly.
Yeah.
So these all leaders of staff, executive staff?
Leaders and some executive staff.
Okay.
Okay, moving on, we have metrics. This is for, the first one, this is for our system compliance program. And this is for the period of 12/1/24 to 8/31/25. We had 558 contacts this year, and that is down from 703 last year. Largely, the reduction is in the contracts bucket. Compliance is not reviewing as many contracts. Moving forward, given the turnover in our office and a need to prioritize other tasks. Director Kim, we had privacy. You're right, it did go up from 20% to 43%, the privacy bucket, and I do believe this is because of the privacy training course, that refresher course that we have done. A majority of these contacts are to report incidents that don't rise to the level of a breach, but are an incident, and it's a great opportunity for us to train on and to promote our privacy program. So an example would be someone finds a patient list in the bathroom. They give it to us, and we try to figure out who the list is from so that we can notify them of the proper security methods to go through, and we report it as an incident.
Great, thank you.
Next slide, we have the county care metrics. Here we have, same time period, 882 compared to 733, so we are 150 above last year's contacts. And for this one, you can see that the largest buckets are fraud, waste, and abuse and contracts. And because they're so large, we thought we would, in future reports, divide up these two buckets so you have more of an understanding of what's made up, this 90% of the contacts. So please look for more detail in the next quarter. And then we have recoveries to share for county care. On the left side is the recovery metrics, and on the right is the proactive preventative loss. On the left, the recovery metrics, the first bucket is the fraud, waste, and abuse investigations, and you can see that in the quarter one it was $9 million, and it's going down since then, and that is the COVID wrap-up. And I think we're going to see these numbers going back to normal, which is about the $1 million, $2 million range, which is how we've been trending. So that is representative in the numbers that we're seeing, so we think that will continue. On the payment integrity audits, this is our clinical audit and data mining. There was a huge bump in Q4, $4.6 million, and that was because we had two providers that didn't provide the results, the documentation that we asked for, and so it resulted in a technical denial. However, these two providers have an opportunity to appeal, so we might see this decline, but that was the reason for the bump there in Q4. And then on the right-hand side, the proactive preventative loss, we are still seeing some, you'll see it's going down from Q1 to Q4. Again, this is the COVID lab claims. We have put in a prepayment review process for COVID claims, and that is still catching claims before they're paid, and we are still seeing that. It was a little bit surprising to us. We don't think that will continue, but that is the result. That is the reason why it was higher in earlier quarters. Any questions on that?
So proactively, prevented a loss of $14 million.
Yes,
Okay, I think that's significant to point out,
yes, yeah,
by being proactive and
Yep.
doing the audits.
right.
Yep.
Before we actually pay, so
Right.
it's processes we put in place to prevent a claim from being paid.
So you can, so what we are saying is that we can credit that with the work that you're doing.
Yeah.
I just want to make that clear. If we weren't doing that work, we wouldn't know, and we wouldn't have
Right.
made that discovery.
Thank you. Next slide. National Compliance Week is November 2nd through the 8th. It's the first week of November. And like last year, we are going to both do a system-wide quiz of all our staff with a chance to win prizes. And we are visiting, we selected 3 ACHN sites where we'll have a table with a spin the wheel, answer a question, and chance to win prizes as well. We look forward to that every year, so that's...
If you could send out a schedule, maybe some of us can attend.
Okay, yes, I will. That's it for me, unless there's questions.
Any additional questions? If not, and we're under item number 3, can I have a motion to approve the proposed Audit and Compliance Committee Charter and the proposed Corporate Compliance Steering Committee Charter? Are there any questions on the motion? Hearing none, all those in favor say aye.
Aye.
Aye. Motion carries. The next, I guess, is the action items, the minutes. Okay. Can I have a motion to accept the minutes of July 18th, 2025, Audit and Compliance Committee meeting? Are there any questions on that motion? Hearing none, all in favor? Aye.
Aye.
Any opposed? The ayes have it, the motion carries. The committee will now be going into closed session. Action is not anticipated to be taken in open session after the closed meeting has adjourned. Can I have a motion to go into a closed meeting pursuant to the following exceptions to the Illinois Opens Meeting Act 5 ILCS 120/2 parentheses C 1 and 29. Is there a second to the motion?
Second.
Motion has been moved and seconded. Are there any questions? Hearing none, Madam Secretary, it's your turn.
It's a roll call vote, and you only have 2 members here, so, aye or nay to go into closed session. Director Kim? Yes. Director Ryder is absent, and Chair Harrington.
Aye.
You have 2 yeas and 1 absent.
The motion carries. We'll now be going into closed session.